2019, AAR Hospital opened its doors with a dream, not just to treat, but to transform how healthcare feels. It started with a vision, a dedicated team, and an empty building filled with possibility.
My thought about AAR Hospital goes back to when AAR Hospital was being constructed. I was passing here as I was going to my previous job, and I could see a beautiful building coming up. Then later I confirmed it was AAR Hospital, and I started praying about it, that I could be one of the pioneer nurses to open the facility.
My very first weeks at AAR Hospital, when I joined AAR Hospital, it was still a construction site. So things that I remember. One, I wore jeans to work. Yes, so I think that was fun. But seriously, I remember coming to the hospital wearing a hard hat, an incomplete building, no paintings done. I'm taking doctors around, using my imagination to let them know where things would be, what they would evolve to be, and working closely with the architects and the construction team as they built the hospital.
The outward was just the way it is at the moment, but in the inside, it was just like a hall. So we had to bring up equipment, the installation, and set up a patient setup so that the patient could come in and occupy. So we did a few things here and there, including the installation of an oxygen tank, which was really a good initiative to come through. One point which was hilarious to me, there is a point before we will install the oxygen tank. We had a Manford, which was carrying around 10 cylinders. So we will not automatically, but manually switch to other one when one is complete. So I'm here alone working. I've left in the evening at 5. Then at 6, I'm getting a call. There is no oxygen. Get going on. I see you. So I had to drive from home, where I stay a little bit far, up to the hostel. The last part of it is there is traffic. I put the hazards, I was running like this. And the good thing on the road, people were clearing the road for me, saying, let him go. So they thought I had a patient. Thank God it came to tell I was here, and I had to sort out the issue, and I switched on to the other bank of the oxygen.
I remember one of the most difficult part of it was the post-construction cleaning. Cleaning up the hospital and setting up things where they're supposed to be. We came into a hospital that had beds all over. They were not in their particular wards. The seats were all over, not in their particular places. Worktops not well placed. And all this was looking at us. And I remember at some point I looked at my friend and I told her, no, this is not it. There's no way I'm going to make it out of this place. Let me just quit. But well, looking at it, moments passed, and I look at it from the positive and the growth pattern of it. Running off this particular docket support services, initially it was quite very difficult to coordinate all these elements together. But today, call me at 3 a.m. and I'm ready to learn. I know which buttons to press, where to go, who to call, how to escalate, and how to make things moving very fast, and to make sure that each and every staff that comes to AAR Hospital feels supported in terms of the support services that we offer them.
Four years later, that dream lives on in every corner, in every smile, every recovery, and every quiet victory we've shared together.
When we started, we didn't have a finished building, so we were working out of George Williamson and even sometimes working from home. So we'd have our senior management meetings online. So the day when we came into the hospital, I think that's when you realize, indeed, it's a hospital. I think that was the first, hey, it's actually not a construction site, it's a hospital.
So technology has helped us in a big way to move from the usual paperwork to the automation of the systems. And I remember even currently we are using what we call the Damusasa, which is a system that is a technology that is helping us to collect information about those who are giving out blood, those who are donating blood. Initially, we used to use papers, writing on documents, but currently we are using automation. Our systems are automated in such a way that indeed everything, and even those who are donating blood, it makes their work easier.
Over the last 4 years, the laboratory has really changed in terms of test volumes, in terms of the confidence that we've been able to create in the lab users, and also in the quality of results that we have been able to issue to the doctors and our patients.
Every great institution is built not just by plans, but by people. People who said yes when the path ahead was unclear. People who laid the bricks of belief long before the results were visible.
I remember we reported the first day on the 2nd of July 2021. And we had a moment of induction, where we had an induction session for about a week. And after the induction session, it was now a moment for about a week to set up the departments. And I remember on the 19th of July 2021, when we received our first patient. And this patient was having a condition we call diabetes ketoacidosis. We were ready for this patient. And I remember we were able to give the immediate care that was required. At that time, we were having an emergency setup in outpatient where we had put up about 4 beds to handle emergencies. And this patient was able to be admitted in ICU. And after a couple of days, the patient was discharged. So if I look back to the kind of care that we gave to this patient, it's the kind of care that we are still offering to our patients at this time.
When we joined AAR Hospital in 2021, AAR Hospital was a toddler who was learning how to crawl. And we fell down a number of times, but now we are teenagers who are ready to take up what it takes, all the challenges, explore the world, and find our way during the storm. We are AAR Hospital for the strengths that we built when the facility was starting.
I think milestones at year 4, we think of patient volumes, quality of care, the fact that we've been Safe Care accredited. I think those are some of the obvious milestones. But I think there's some milestones that are understated. I think we have quite a vibrant workforce. A milestone is that we are becoming a team. You can feel it, that people like each other, that they respect each other. You can see and feel teamwork. Where are we going to be at year 10? I really think AAR Hospital will be a force to be reckoned with, not just in terms of quality of care, because that's what we're expected to provide. We're expected to provide high quality, affordable care, not just to the citizens of Kenya, but to anyone who encounters us, even beyond the borders of Kenya. I'm looking forward to that culture where we are a preferred employer, where people are leaving places of employment to come to us because it's a happy place to work, in spite of the fact that it is in healthcare. I was reading our newsletter and I was reading the article from the finance team, and I think I mentioned it. I think it's a breath of fresh air in terms of how they look at healthcare. And they said not about scalpels, but Excel sheets and saving lives via Excel sheets. So I'm looking forward to where everyone realizes that everything that they do plays a part in the hospital's success and the quality of care that we provide. And I think that will happen way before year 10. But 10 is a nice number to mark. So I'm excited.